Michigan cannot seem to get out of the fast lane on COVID-19. We remain among the nation's hotspots, and now we have doctors and hospital administrators begging for help from both the U.S. military coming in to help backstop the care struggles, and from those who still haven't gotten the vaccine because they continue to be the ones filling hospital beds and sadly dying. Let's talk about it all with Dr. Jim Baker, an immunologist and founder of the Allergy Clinic at the University of Michigan, but also lead investigator on the NIH National Study on mRNA COVID vaccines. He runs the Pandemic Pondering blog. Dr. Baker, I know you have pondered this now for quite a bit, but I'd like to start today with why can't we get the upper hand on this thing 2 years in particular in Michigan?
Well, Michigan is somewhat unique because early on we did a very good job of protecting people. So we had very few people that got infected over time. And then we unfortunately did not vaccinate as well as we could have. So when we released restrictions, there were a large population of unvaccinated people that got infected and now spread the illness. What we're seeing right now is pretty remarkable. Most of the outbreaks are in the K through 12 situation in schools and in nursing homes. And in nursing homes, particularly, half of the people working there right now aren't vaccinated, which is pretty amazing to think about.
It's astonishing given what we know about the efficacy of the vaccines. We also, I think you and I spoke about this before our conversation here. We've got a little, it's kind of confusing for people right now. On the one hand, they're being told that we really need to worry about the Omicron variant. On the other hand, Pfizer comes out and says, if you just get that third shot, the booster, you should be okay. So where are you, what are you advising people to think right now?
Well, it's been very confusing. And part of this is they're using tests to see if the vaccines will work that really aren't reflective of the real life ability to protect people. I think what we're seeing now is that there is some cross-reactive immunity to the new variant. And I think that's probably a good sign that the vaccines will provide some protection. The real key is that we have to get everyone vaccinated. You know, all pandemics end. I mean, there wouldn't be human beings on this planet if that weren't true. But we have the ability to end this thing in a way that doesn't result in additional deaths or additional hospitalizations. And that's almost entirely with vaccination. So I really am comfortable that if people are vaccinated and are vaccinated well, maybe with a booster shot, they aren't going to be really affected by Omicron the way people have been concerned.
You worked, of course, on the mRNA vaccine, and that was a component of this that was groundbreaking and yet so worrisome to some. We have found so far that this is an incredibly safe vaccine, haven't we?
Yes, people argue that there hasn't been formal approval the way other vaccines. We've given this vaccine to more human beings than any other vaccine in history. And if there was some smoking gun about toxicity or another issue, we would know it by now. These vaccines are remarkably safe and almost unbelievably effective given what we've seen. And the real issue is getting everybody vaccinated so they're protected and they aren't spreading it to each other.
We even had the Attorney General of Oklahoma, though, this past week refer to it as still being experimental. That kind of talk from public officials, I'm assuming from reading your blog, drives you to near madness.
Yes, it's more than a little frustrating. And I think the saddest part is that the people who are listening to this and trying to do the right thing are confused. And they aren't really doing what would be in their best interest, which is to get vaccinated. I mean, we've all seen people come in, you know, and it's not just elderly people, although they're more likely to have problems with this infection, but young people come in, are sick, are dying. We've seen in Michigan, you know, pregnant women who've come in and died because during pregnancy, your immune system doesn't work quite right. These are really sad things to happen when we have a tool we can use to prevent it.
Well, and we also have more doctors talking about the ripple effects. When beds in hospitals, and we see so many hospitals now that are pretty much at the brink, when they are filled by COVID patients, then other things are not being taken care of. Other more routine care concerns become suddenly emergency situations.
Yes, and I can tell you every day at U of M, we get notified that there are 10s, 20s, 40s of people in our emergency room trying to get into the hospital. And these aren't things that could be pushed off. These are emergencies that need to be brought in, and we just don't have beds for them.
So where's your sense of, because everybody keeps trying to figure out where the corner is on all this. If you'd have told us at the beginning that this was going to be 2 years of the way we've lived, I'm not sure many people would have signed up for that, and yet here we are. What do you see as making the real difference? And can we turn the corner, or is this now just the beast that we have to live with for perpetuity?
Well, it really isn't a corner. It's sort of a slope. And what you can see, with other pandemics is that over time, these waves get smaller and smaller and smaller and just basically peter out eventually. One of the things that we're doing now, which is making it harder to understand, we have much more sensitive tests to detect the virus. The PCR test detects the virus to an enormous degree. And in fact, it can't even differentiate if the virus is alive or dead. So in many of these people who are having asymptomatic infections or mild symptoms, they have immunity. They aren't getting sick. And before in a pandemic, we probably wouldn't even know that they were reinfected or were shedding virus. So I think if you look at this overall, these waves have gotten smaller. Certainly in places where more people have been vaccinated or more people have been infected, you're seeing people that maybe get sick or get some symptoms, but you aren't seeing the overwhelming hospitalizations and deaths that we're seeing in areas where people aren't vaccinated. And eventually, that'll all burn itself out.
This is all great common sense advice. If you are looking for more common sense, I heartily recommend Dr. Baker's Pandemic Pondering blog, which we will put a link to on our Flashpoint page at clickondetroit.com. Dr. Baker, thanks so much for the time. Happy holidays and stay safe.
Thank you, Devin.
You bet.